Have you ever wondered, what is an acute disease? An acute disease is a type of condition or disorder that appears abruptly and has a relatively short duration. This swift onset can be jarring, and often the severity of these diseases can be quite fulminating. But don't mistake acute for always being severe. For instance, the common cold, also known as acute rhinitis, comes on quickly but is far from life-threatening. To put it into perspective, let's briefly contrast acute diseases with chronic diseases. Chronic diseases typically have a slow onset and a long duration, often persisting for months or years. However, acute diseases are like a storm that comes suddenly and leaves just as quickly. It's important to note that acute diseases can affect any system within our bodies, but they usually target only one system at a time. So, in simple terms, an acute disease is a sudden and short-term illness. Now that we know what an acute disease is, let's delve deeper into its characteristics. Acute diseases can range widely in their severity. On one end of the spectrum, we have mild conditions like the common cold, also known as acute rhinitis. This condition comes on quickly but usually isn't severe. It's a nuisance, yes, but it's not life-threatening. Then we move up the severity scale to conditions like strep throat or influenza. These acute diseases are more severe than a common cold, but in most cases, they don't require hospitalization. Usually, they can be managed at home with rest, fluids, and over-the-counter medications. However, on the far end of the spectrum, we have acute diseases that can be life-threatening, such as pneumonia or acute myocardial infarction, more commonly known as a heart attack. These conditions require immediate medical attention and often an extended period of treatment. Another characteristic of acute diseases is that they usually affect just one system in the body at a time. For example, acute respiratory diseases affect the respiratory system, while diseases like appendicitis impact the digestive system. It's also important to note that even though acute diseases can be severe, they don't typically have long-term health effects. Once the disease has been treated and the body has recovered, there usually aren't any lingering health issues. However, this isn't the case for all acute diseases. Some, like a heart attack, can lead to long-term heart damage. So while this is a general characteristic of acute diseases, it's not a hard and fast rule. Finally, the onset of acute diseases is usually sudden and rapid. One moment, you're feeling fine, and the next, you're hit with symptoms. This is why it's so important to seek medical attention if you suddenly start feeling unwell. In conclusion, acute diseases differ quite a bit in their severity, from the mild nuisance of a common cold to the life-threatening severity of a heart attack. They typically affect one system at a time and often don't leave long-term health effects. This means while some acute diseases can be managed at home, others require immediate medical attention. But what exactly causes these acute diseases? Well, more often than not, acute diseases are triggered by an infectious agent, making them a frequent occurrence in communicable diseases. These infectious agents can be bacteria, viruses, or even parasites. They invade our bodies, multiply rapidly, and cause illness. For instance, the flu is caused by influenza viruses, while a strep throat is due to a bacterial infection. Yet, it's not always about invasions from external agents. Sometimes acute diseases can result from internal factors as well. Acute pancreatitis, for instance, can be caused by gallstones obstructing the pancreatic duct. Moreover, acute diseases can also be the result of lifestyle choices or environmental factors. For example, acute bronchitis can occur due to cigarette smoking or exposure to air pollution. Similarly, certain dietary choices can trigger acute diseases like typhoid, which can be caused by consuming contaminated water or food. But here's the silver lining. Many acute diseases are preventable. Simple lifestyle changes can sometimes make all the difference. Regular hand washing can prevent many infectious diseases, while avoiding smoking can protect against acute respiratory illnesses. Opting for clean, safe food and water sources can prevent diseases like typhoid. So, while acute diseases can be caused by various factors, many of them are preventable through healthy habits. So let's keep ourselves informed, make wise choices, and strive for a healthier tomorrow. So, how are these acute diseases treated? Well, the answer to that question is as varied as the diseases themselves. Treatment for acute diseases is largely dependent on the nature and severity of the condition. Let's take the common flu, for instance, which is an acute disease. It's typically handled with at-home care. Rest, fluids, and over-the-counter medications can help manage the symptoms until the body fights off the virus. The same goes for conditions like strep throat, where antibiotics prescribed by a doctor can clear up the infection and the patient can recover at home. Now let's consider more severe acute diseases. Pneumonia, an acute respiratory disease, can require hospitalization, especially in high-risk individuals. Antibiotics, oxygen therapy, and even ventilation in severe cases are used to treat this condition. Similarly, an acute myocardial infarction or heart attack is a life-threatening condition that requires immediate medical attention. Treatment may involve medication, surgery, and extended hospitalization. In some cases, acute diseases like typhoid, caused by consuming contaminated water, can be prevented altogether by making simple changes in diet or living conditions. So, the treatment of acute diseases largely depends on their severity and the affected bodily system. From home remedies and prescription medications to hospital stays and surgical interventions, the approach to treating these conditions is as diverse as the diseases themselves. It's essential to understand this diversity in order to effectively manage and overcome acute diseases. Let's recap what we've learned about acute diseases. These conditions are characterized by their sudden onset and rapid progression. They tend to be fulminant in nature, meaning they are severe and can result in serious consequences. Unlike chronic diseases which persist over a long period, acute diseases have a relatively short course. They can be caused by various factors, primarily infectious agents, making them common in many communicable diseases. Acute diseases can affect any system in the body, but they typically target one system at a time. Treatment varies widely depending on the nature of the disease. Some, like influenza or strep throat, may not require hospitalization or intensive care, while others, such as pneumonia or a heart attack, require immediate medical attention. Importantly, acute diseases often don't have long-term health effects as they can be treated once and for all. Remember, understanding acute diseases is the first step towards prevention and effective treatment. Stay informed and stay healthy.